You mentioned, I think, a conference. I'm not sure what was the context. You just mentioned the conference, and I'd like to backtrack a bit. Why did you choose the American College of Cardiology?
Well,
Why?
basically, I'm sorry, what did you ask the last time? You said when?
I was just going to rephrase the question. Why their conference?
Why their conference? Okay. So basically, what happened is I was taking a course with Dr. Henderson, the meta analysis course. So he has a meta analysis course, and then I was in this course, Meta Analysis Academy today, they call it. And in there, I made connections. Basically, I had an idea for a meta analysis, and then I told one of the tutors that was working in the course, and I was like, oh, look, I had this idea and stuff, maybe we could do a meta-analysis about this and blah blah blah. It was actually something that a professor of mine told me, like he was curious about this topic. It was about poly pills. I don't know if you've heard of it, but for hypertension, instead of just giving 4 or 5 pills to patients, is it better to give just one poly pill with all of the all of the medications in it? If does it improve adherence? Does it make systolic blood pressure better? Does it improve death? And so on. So I told this tutor about the idea, and he told me that there were two other students that had the same idea, and each person in a different place of Brazil. And then he was like, I'm going to put you guys together. And then he put us together, and some other tutors joined this group. And the ACC application was very soon, like it was very close. So we basically had the same idea at different places, basically at the same time. So basically, we formed a group, and other tutors joined this group. And the ACC application was very close. I think 2 weeks from that time that they put us together. So it was kind of like a race for us to apply and to submit the abstract. I don't remember if it was exactly 2 weeks, but it was very soon. Like it was very close. And then we submitted this paper, this abstract, and after some time it was accepted. And why did I choose the ACC? First of all, because it was the first conference that was, the
The closest,
soonest, the closest, exactly, this closest conference that was going to happen. Second of all, because it was really hard for me as a student to come up with an idea of a meta analysis. And when I finally kind of had the idea, it was kind of in a discussion with a professor. And also, I even asked him if he wanted to be in the meta analysis, but he didn't want to. But he was very happy for me that I got in the group, and we, developed everything, and we did the paper. But it was very difficult for me to come across a good idea, a good meta-analysis idea. And I saw it as an opportunity. And at that time, I was very into cardiology. As I told you, I'm into a lot of things. I'm into a lot of interests. I get interested very easily. And cardio is very fun and very visual. I think cardio is very, you see things, there are tests, there are imaging exams that you can do, there are lab tests that you can do. So it's very visual, and it's very fun. I think cardio is very fun. There's the EKG, that you see things with your eyes. Like it's not as subjective as, I don't know, psychiatry, for example. In psychiatry, it's very subjective. But cardio is very objective, it's fun. And at that time, I was very interested in cardio. And then that's why basically we chose the ACC, because it was closest. And I chose cardio because at the time I was very interested in cardio. I even considered to do cardio as a residency. And I'm going to tell you, it's not off my plate completely. have been thinking of cardio. And I think it's, although we have a lot of cardio patients who already have, diseases, heart diseases, I do believe it kind of enters the preventive medicine area in a way, because the person has the disease, but you are preventing other diseases from developing. So in a way, I think that cardio is very, not very, but in a way it is preventive, I would say.
Cardiology is very visual. You are telling that to someone who does cardiac animations. Of course,
Yes. Oh my God. And your animations are the best.
sometimes
Exactly.
people ask me why I make cardiac and lung animations mostly. And the truth, the most plain way to put it, is because they look the best. Hearts
Yeah.
beat, lungs inhale and exhale. You have movement. Of course, I did, for example, videos on the hand. You also have movements. But sometimes people ask me, could you do a video on neuroanatomy? And well, first, neuroanatomy is not exactly my favorite topic. But that set aside, we don't have that much movement, so to speak, in the brain. Of course, you could represent something, you could go on the microscopic level, but one of the
Yeah.
things I like the most about animating the heart and the lungs is that you can see them moving. You can put movement to them and see what would be seen macroscopically if you could actually cut and look.